If you are a pet owner, you might know that eye problems are actually pretty common, ranging from common issues like dryness, maybe more serious ones like cataracts and glaucoma. But no matter what the concern is, you want someone skilled in taking care of your animal's eyes, just as you would for your own. So I'm happy to have Dr. Terah Webb from MedVet joining us for this sponsored segment. Good to have you.
Thanks for having me.
All right, I want to share some background on MedVet Columbus and just what you do here in the capital city. You've been here quite some time.
Yeah, MedVet has been here for over 30 years in the Columbus location, and then they've grown across the nation to over 35 locations. But in Columbus in Central Ohio, we're lucky to have 3 locations, not only Columbus, Worthington, but on the west side in Hilliard and on the east side in Diley Hill.
And you offer a number of services, right, for animals?
Yes. So all 3 locations here in Central Ohio are 24-hour emergency, critical care in some locations, but daytime hours are specialty care, mostly in the Columbus location.
Let's talk about that specialty care. Not everyone understands that specialty care exists for our animals, right? We think a veterinarian is the one who takes care of all that ails our animals. Not the case, though.
Right, and a lot of veterinarians do all of the things and do it very well. But if it's a complicated case, then they may refer you to a specialist. If there is a specialty for human health care, it exists on the animal side as well. So most veterinarians stop at vet school, but we extend our education an additional 4 to 6 years, training under other specialists before sitting for rigorous testing to become board certified.
And you are that veterinary ophthalmologist. So let's talk about eye care. What makes that specialty so different, so complex?
Well, just like human health care, small organ, small area for disease to add up very quickly. But we also are connected to all the other body systems. And so we often have to work with other specialists, which we're happy to have all under one roof to provide that quality care. We work with dermatologists, anesthesiologists, neurology, cardio, the list goes on and on, because that eye is so closely connected to other organ systems.
Absolutely. And as we are going to watch some video of an eye exam happening, I want you to explain to us if somebody brings their pet in and whether or not they may notice some symptoms or not. They may say, you know, check out a dry eye, and then you find something else. So what does that eye exam look like?
So we always examine every pet with the owner present. So the patient is more relaxed, the owners can see what goes on. But we start by testing tear production, we measure for glaucoma and check the pressure. And then we use a variety of instruments to do a full exam like you were going to your own ophthalmologist.
Yeah, and we're watching a video now, obviously, of that happening, and you can tell the animal is going to be more relaxed, obviously, with their owner present. So it's a great way to do that first, and then probably from there you can figure out a treatment plan if something is wrong, right?
Yeah, so we explain to the owner what we're finding, what are testing options, what might that entail for them and for their pet, and how can we move forward for the best outcome.
And I mentioned it is, or I didn't mention, I said glaucoma in the introduction, but it fittingly is Glaucoma Month. What does that look like in an animal? I was even asking you before this, like the difference between glaucoma and cataracts, and similarly in humans, right? But what does that look like in an animal?
Well, advanced glaucoma is a big swollen eye, painful, cloudy, very obvious, but the early symptoms can be very minor. And so I always tell owners, if you notice a change to how an eye looks or feels to your pet, you should seek care from your veterinarian at least. And so changes in color, discharge, cloudiness, and then pain, squinting, irritation, rubbing. We want to find things earlier rather than when it's too late.
And what is the treatment like for that?
So glaucoma can start with medical therapy just like in humans, but for the refractory cases, also like in humans, we do a lot of glaucoma surgery.
Are there different breeds too that are more inclined to suffer from that?
Absolutely, and some can be born with it. So it affects all ages, but breeds like Cocker Spaniels, Huskies, Beagles, the list goes on and on. A lot of them can have glaucoma.
And to notice some of those issues, that maybe even the more common issues, do you look for those during kind of an annual exam with a pet, or how do you spark those and find those, or is it often the owner that notices?
A little bit of both. So every day we get referrals from family veterinarians who find things on exam that were never noticed by an owner. But it's those more urgent cases where the owner has to call and get care from their vet, or after hours, weekends, coming through one of our emergency departments to get that care right away when there's something really wrong.
But the good thing is it is a treatable thing, as it is in humans, it is in animals, right? So to know that there is help.
There is help.
Absolutely. All right, let us know too. You said MedVet has a few locations, so we can probably just send our viewers to the website, right?
Yeah, medvet.com, and all of the locations are listed. All the specialties that are within those different centers are there.
Okay, perfect. Well, thank you so much for being with us.
Thank you for having me.